presenting on succession planning. Just a disclaimer, these are my thoughts. They are not those of the VA. About me, I went through the UConn Clinical Engineering program with Frank Painter back in 2012. I, at the same time, was working at St. Ray's campus when they got bought by Yale, stayed on there for roughly 10 years per diem, just going in once in a while, and interned and worked at Middlesex Health, worked up through their first engineer to become the manager. Relatively recently, in the last year, I moved on to the chief role at VA Connecticut Healthcare System. And I've presented previously on topics at MD Expo, AMI Exchange, NESCI, quite a few different topics. Always try to keep it roundabout. So just summary, I'll go through a quick little fun poll to gauge the room. We'll talk about why succession planning is generally important and some strategies that exist per role, or some concepts that I've come up with. And there's a scenario that is at every chair and table. So we'll run through 2 different scenarios and have some fun with that. So general poll question, do you have any anticipated staff retirements in the next 5 years? Just raise your hand if yes. Okay. Do you feel prepared or do you feel scared for that? Just yell it out. I'm seeing some faces that look scared. That is fine. Second question would be, have you had to deal with an unexpected resignation? Seeing nods. How would you categorize the impact? Terrifying. Okay. Anyone have a fun story to share of how it impacted them? Wow. No one wants to speak up. Hi. Go ahead, Frank. Okay. That's rough. How was the impact to the institution at that time?
I think everyone sort of said, hey, we'll go with the flow.
Okay. Contracts, or just did the staff like?
We just felt behind.
Okay. All right. Thank you for sharing. Go ahead.
It's also, it always happens in threes, and we had one team that was severely understaffed and had to have creative staffing models to bring FTEs from other teams and support.
Creative's a good word. My grandmother used to always tell me everything happens in threes, so always got to be ready after that first one. Oops, hit the wrong button. Anyways, do you have a current succession plan? Seeing no's, a lot of no's. Okay, so hopefully this helps. If you did have one, or if you currently do, does it specify specifically based on the work that each staff member is performing? Anyone have one that? Okay.
And like that person is like, when they leave, like no one can feel it. You know what I'm saying? No one can really more role-based.
Okay, but task-based or just strictly role, so very broad over? Okay. How often would you say that you review that? Annually? Okay, that's good. So some reasons why succession planning is important would be that there's significant anticipated growth of the field. We'll go through those numbers. There are immediate consequences to losing staff, as Frank mentioned, albeit 3 at once is quite challenging. And there's also long-term consequences of having that staffing shortage. So we'll run through those scenarios. This one's actually a fun piece of information. So previously I presented on filling vacancies, and at the time the US Bureau of Labor Statistics predicted I believe it was a 7% growth of the field by 2030. It is now 18% growth by 2033. That is a massive increase that I did not catch until I actually started building these slides. In comparison to other occupations, that is what they classify as much faster. So I think when I looked at the chart, we were just below the top 10 for our field, which is something that you don't even want to be in, because I don't think we have the pathway of people coming into the field right now relatively strong. So it's something that needs to be immediately addressed or be prepared for. So it's estimated that about 7,300 openings per year, and it's primarily because of retirements or transfers out of the field. So that would be people leaving our industry or people that are retiring. The average age is estimated to be 47, with 44% under 40, but nearly 48% of the entire workforce is over the age of 55. Those numbers don't add up. That is different sources, but reasonably similar scenarios. So that's a challenge, considering that the workforce, the relatively majority of the workforce is expected to be retiring. We have no one coming into the field. You're going to need to be prepared, and succession planning is the best way to get ready for that. So some immediate consequences of losing staff would be the initial response. What do you do in those moments of time? So you evaluate, you hand off that current work, as Frank mentioned. They just kind of knuckle down and dealt with it. May require contracts. You might have that one in particular individual, as Nicole had said. You can't just replace a person. Their knowledge, their expertise, their training, that's probably going to be contracted if it's a specialty. Training costs and time. There are not only significant costs, but it also takes extremely a large amount of time to train somebody, depending on the modality. So you have to be prepared and plan that out, because some training schools aren't offered every month. They're offered once a year. So if you have somebody that is leaving or expected to leave, and it's something that you should already be aware of, not having that bench built is going to create a challenge, and be prepared to take that handoff. So there's also prerequisite courses. Perhaps that one training class that's only held once a year is before the prerequisite class that year. So you're talking about a 2-year plan before you even get anyone up to speed. These are the challenges, not only just with the concept of budgeting and being prepared to absorb that cost. So the time to hire experienced staff, if you think that you can just, well, you know, I lost my ultrasound guy, I can find another one, great, we'll post it, get filled tomorrow. No, that does not happen, unless you're super lucky. And if you are, you probably shouldn't be in this session. You should be out there gambling. It can be long and completely unreasonable. You are going to have to absorb that contract or that time and materials cost. So you can't have the downtime if you're in a private sector institution where you're relying on that revenue and that system is down. Any cost that you're going to spend on that equipment is going to be completely overlapped by that loss of revenue, if it's a highly utilized system. Not to mention the impact of your patients to the institution's image in the environment. All of that has a downstream effect. So we do play a significant role in that. So being prepared with a plan at the very least can help. There's plenty of seats, come on in. So some long-term consequences. This is based off of a couple of assumptions. So if you imagine that available maintenance hours are 80% of your staff's time, they're not performing maintenance activities 100% of the time. You have 6 technicians dropping down to 5 on month 6. You've previously operated evenly. The workload that was planned was always matching up with the available hours. Well, the minute you lose that person in that first month, you're going to start to see that deficit of that workload. But then that's going to compound. and it's going to continue to compound until you backfill that or you get that work done by alternative means. So the longer you wait to fill that position, or the longer it takes, or the longer you take to address it, is making it significantly worse over time, which that then creates an impact to your staff. So if we run through this, you lose an employee, the workload's going to increase. Well, now you're going to start to see key metrics degrade because you're going to start having competing priorities. You're focused on maintaining compliance and ensuring the safety of the patient, so your PMs are getting done on time, but meanwhile correctives are piling up. The comments start to fly out there that, you know, there's this graveyard in the basement of equipment, don't know what happens down there. Your compliance starts to slip because you start to divert resources, start trying to address that graveyard equipment, fix the corrective maintenances, turn that equipment around, but meanwhile the PMs are starting to pile up. It's always a juggling act. You're dealing with less staff, that's why. Staff demand rises, you start to ask for more use of overtime, you start to ask for additional staff. The corrective maintenance demands start to increase, or possibly can, because your preventive maintenance activities are now either not being completed, or it's possible that it's being rushed and you're missing steps. The staff are trying to get that number down and address the work as fast as possible, but they're skipping crucial steps. Maybe they don't check that widget that they usually check, and corrective maintenance start to increase. Downtime starts to occur. Frustrations rise. The clinical team starts to get extremely upset with your staff, upset with the turnaround time. Inventory, you start to get demands of, well, we need to buy more pumps. That'll fix this. Pumps are down, just buy more, quick, get them in. Okay, that's easy. $1,200 a pump, order up 30, get them in. Well, that just increased your inventory, that increased your workload. You also have to check them in. So there's costs associated with that. You've just increased your inventory, there you have that bulk capital cost. You now also have that ongoing expense of that equipment that's sitting there, likely never going to be used if everything is repaired appropriately when your staff staffing is set again. Your external costs are going to grow because now you have that additional equipment. You're now having to spend additional money there. You also have not fixed your staffing issue. So equipment doesn't just break down because you don't PM it. Equipment breaks down because perhaps it gets misused, perhaps abnormal failures. Well, you're still running in a deficit. You've increased your workload. You have the same staffing. You didn't change anything there. You're already having them work overtime. So you can ask them to work more. I'm sure some staff would love that. That does increase your costs. But if you're trying to avoid that frustration rising and those downtimes on critical devices, you're going to have to pay out of pocket to get someone else in. And that's coming at a premium because in-house service is always going to be cheaper than external labor. Well, now your staff also sees that. Your staff sees the comments. Here's everything that's being said in the facility. They also now see a premium contractor coming in, doing the work that they could have done. So pumps, for example, you can call in a company and have them come and help service your pumps. Oh, PM month, it's great to have that extra set of hands at 4 times the cost of your existing staffing. And they'll see that, and they'll also start to get demoralized because they're seeing a premium contract get cut for relatively subpar work because they are not used to that facility. It takes time to ramp up someone coming in. So even a contractor that's experienced, they're not going to hit that ground running. So you're going to be paying for that training time. So that could potentially lead to losing more staff, growing this problem. So this spiral just continues to occur. I know it's a bit apocalyptic, but it's certainly possible. On that past presentation that I spoke about, I talked about more on the hiring side of things and the recruitment service. So the way that I look at staffing is, I think of it in these 3 bubbles. Prevention, which is your retainment of staff. What can you do to be prepared and to ensure that that retention and those strategies are implemented? Preparedness, where you're ready to absorb that loss of staff if that does occur. There's always promotional opportunities. That's great. Those are wonderful things for your staff, and that's what you should absolutely encourage and want for them. But at the same time, you need to be prepared to accept the consequences of that. Or if someone just chooses to leave by means of retirement, they're moving, anything. There's that response as well, where you're looking at how do you handle recruiting. So those do overlap a little bit. The way that I've looked at it was prevention kind of overlaps with preparedness, because the more that prepared you are, the more you can also prevent someone from leaving. Preparedness overlaps with response, because if you create that pipeline, then all of that work, working with institutions, I think Sam, you mentioned earlier this morning that you work with different colleges and high schools, talking to students, you're building that rapport. That's hopefully going to pay dividends on that recruitment side of things, right? But primarily we're going to talk about that section of preparedness right in the middle, where having that succession plan is going to help you maintain long-term. So some succession planning strategies, employee discussions. So understand the employee aspirations. Understand what the mindsets are. Not everyone wants to be a supervisor. Not everyone wants to go into radiology. So you need to understand where they are thinking that they want to take their career, so that you could help align your plan in a fashion that is going to make use of their desires and abilities at the same time, or help grow them towards that, because perhaps they don't have those skills yet, but they are interested in gaining those. So determining those education gaps. You want to do a gap analysis on, in particular, service of equipment. If you don't know that one person is trained on a particular device modality and no one else is, then that's a clear gap. That's a clear risk to the institution. If you lose that person, you might be absorbing astronomical contract costs. It all depends. If you don't know and you're not prepared for that, then you're going to be playing behind the ball, and the vendors are going to take advantage of that. Consistently review it. So Nicole, I was happy that you said that you review it annually, because that's ideal. It's always changing. It's never the same as what you wrote yesterday. The needs of today may not even be the needs of tomorrow. So, you know, a good concept is cybersecurity. That wasn't something that was heavily pushed 10 years ago, but now it's an increasing and growing rapidly need. So the staffing model back then of what we would have thought we needed is definitely not what we would think we need tomorrow. Tools available to help with this would be your CMMS data, education folders, competencies, things that you have from, you know, if your staff go out to school, keeping all the documentation. One, you need it to ensure that you're able to provide it if you're ever asked of competencies. Joint Commission requires that. There's all sorts of different standards around it, but that can also help. There we go. So engineer succession planning. For engineers, you want to look at the frequency of their persistent tasks. So things such as daily, weekly, monthly, quarterly, annually, if they're doing them on a cadence, you don't want to lose that institutional knowledge. They're helping keep those lights on by doing whatever it is that may be occurring at that time. It could be capital planning at a certain point in the year. It may be having those sit-down meetings with those directors to understand their needs. That will help if you are prepared to continue that. Because if you miss that, then you don't know until it hits you in the face that that wasn't getting done anymore. So understanding those random tasks that they're doing to assist the department is helpful. Projects, lists of current and upcoming projects. An engineer is typically more involved on those. Having that overview of the needs of why did we go down the path of this project, how did we make these decisions, having those pertinent contacts, the documents. If you lose that person, you're losing all of that knowledge as well. So having that prepared in a fashion where you could pick it up and give it to somebody else give them time to review it. I mean, think of it as a legal case, right? A lawyer inherits a case from a different lawyer. If they don't review those documents, you lost the case. Utilizing a consistent, repeatable project template will help with that. So having something that just helps guide that path to say, did we check all of this stuff down without having that person anymore, allows that individual to then review, okay, they didn't do the 6550 yet. They didn't do their cybersecurity review with the MDS2 and everything of that nature. Perhaps they didn't line up the budget. They didn't compare what was quoted, the needs, against what was actually on the budget. All of those different individualized tasks, knowing where you stood at that time from a different person will help you carry that baton forward. Think of it as a relay race. You won't have the baton then, you're just going to be sitting there making it up as you go. I've been there before. It's fine, you can't. It doesn't mean you can't be successful doing it. It just means that you're going to have a harder time and you're going to get bit by something. And I don't know if it's a Chihuahua or if it's a giant dog, you know. So BMET's succession planning is a little bit different. So they have PMs, they have planned activities, absolutely. But they are also helping keep the lights on. They are doing daily, weekly, monthly, quarterly, annually tasks. Maybe the annual tasks are just health stream. That's a simple one, just move it off the list. But daily tasks, swinging by the OR every morning and checking with the staff, ensuring that the anesthesia machines are up and operational, that's an important step. The clinical team is expecting that of your department. Now you lose that person, that expectation is no longer met. It may not be an expectation that you put in writing, but it's one that they've come accustomed to. So that also results in them solving problems as they're out and about. Perhaps you're not even capturing that in the work orders. You're certainly not capturing the time of day that they're doing it. There's no way. Projects, they do have projects as well. Those may not be planned projects. They may not be something that's drastically budgeted, but it might be that one-off request from a department of they want a thermometer holder moved underneath the monitor, different bracket. Those are still projects. That's still taking research time. That's still taking different things. Understanding where they stood on those without knowing it, again, you're not hitting the expectation of those departments anymore. So those are critical topics to touch on in that phase where they're resigning. Sound like a raptor out there. I'm a little concerned. So one thing that I came up with for BMET succession planning, because they do have those planned activities, they do have corrective maintenance activities, was to try to come up with this one-page card per technician so that it gives you a full insight of perhaps what a year would look like, where your risks may be. It's not perfect, but it may give you some insight. So section 1 would be last year's documented workload. Section 2 could be the projected workload with some assumptions made. Section 2 would be top 5 time-consuming corrective activities across various categories, giving you some sense of insight as to what their most frequent repairs might be. And then top 5 time-consuming preventive maintenance activities. And this could be based on a full year, it could be based on a time frame. All scenarios could theoretically apply. So the initial data that's needed would be work order types, date created, work effort, or your time charges, depending on how it gets documented, the location, the department, the equipment details. You also want to take the preventive maintenance that's planned for next year out with all the same information, but you're going to use that as a projection as well as adding in historical information from the last year on correctives to give you this general assessment. You're also going to want their historical available hours so that you can understand what's going on in any given month So section 1, as I said, it's going to be the prior year workload analysis. So you're going to show the corrective maintenance, the preventative maintenance. Those are your maintenance activities. For non-maintenance activities, you're going to have things like projects, simple incoming check-ins, education, administrative-based duties, things that they have to do, but it's not directly servicing the equipment. The available hours, you are going to project what the theoretical maximum is for that given month. So if the month is 20 days and it's 160 hours, whatever it may be, there's a holiday in there, project that out and then also use the historical. The benefit of this is it's going to help identify concerning months from a historical perspective. So I had one employee historically that used to always take the last week of every single month in the summertime off. And that was a historical bit of information that I knew because I worked there for 10 years. But if you're coming in and you're looking at this as an aggregate, you got to be prepared for those nuances. People have lives, they have entitled time that they're allowed to take. Perhaps they're always taking a cruise in March for 3 weeks every year. And that's why their PM workload is planned low for March. Don't consider March, oh, there's no PMs. This person's perfect. We can just load it up. No, that's, again, you're just throwing yourself into failure. Section 2 is essentially the same thing, but you're flipping out the preventative maintenance from last year with what's projected. The reason why you're adding this in there is because you're trying to anticipate for the growth of the equipment inventory. Perhaps you added an entire fleet of ventilators. If you don't see how it's projecting out next year and how it's impacting that workload, you can't plan, well, why did we put it in the same month that we always did vents in? It made sense because we always do vents in that month. Well, now it doubled the workload and that person can never achieve that. We're now putting ourselves at risk of all their correctives. Or perhaps we're looking for them to no longer do their health stream during that month and they need to do it ahead of time because they're not going to have that time. Or maybe share the load or spread it out across numerous months. This will help you conceptualize that plan. Section 3 is going to be more specific to the equipment associated with correctives. So you'll focus on the specific devices, so unique identifiers. You'll go down to the model level, you'll go to the equipment type, and then you'll go to location. The reason why this is relevant is because it helps identify those primary areas where this person is servicing. So perhaps it's one device that is as old as time, it's been handed down from generations of BMETs. This is how you service it, and it's taking up the bulk of their time. One, that should be on a replacement plan. Two, maybe this person's the only person that inherited that knowledge and no one else did. So think of that as your education gap analysis, right? Consider that as well, because that's not something that they're directly trained on. That's inherited information. You're not going to have a training certificate on it. Models, it's going to help tell you some of the workload that they're doing in particular on, again, that training gap analysis. Maybe that's the only person that went out to DFib training on that one model of DFib and no one else did. The types will help guide you in a fashion of maybe there's a specialty associated with this individual. Maybe that is your high-risk equipment individual that only does vents, defibs, anesthesia machines. They're capable of doing more, absolutely, but this is where they're spending the bulk of their time for correctives. Location is also going to tell you who's that main area that is going to be looking for someone to service their equipment. If it's any of those high areas, respiratory care, OR, critical care, turnaround time's kind of critical. Well, if you lose that individual that's been only capable of servicing their equipment on a corrective, you're going to have a lot of screaming people on the phone, and ones that I would not want to deal with, rather than be happy when they see me. Top 5 preventive maintenance activities would be more focused, less so down to the asset level, but again, you're going to focus model, type, location. This is going to help where you're identifying those training, where that person has that knowledge of how to service the equipment, but also where they're spending their time the most in terms of preventive maintenance activities. So these are things that you can be more prepared for because you don't want to lapse on compliance. Perhaps this equipment isn't breaking down. You would never see it on the corrective side of things, but again, it might be the only person that's trained on it. You're not prepared to then have that compliance continue to move on. And if it's a higher end modality or a high risk device, you're going to pay significantly out of pocket for that service if you had to call someone in because you weren't prepared. So we'll move into the scenarios and we'll have a little bit of fun with it. So what you'll find at your chairs are the documents associated with the scenarios. I'll read both scenario and I'll give the group some time to go over them. And then we'll have open questions afterwards. So it'll take 5 minutes to review them. But scenario 1 essentially is Fred comes into your office first thing in the morning. He's excited. Begins to share that him and his wife, Wilma, are expecting their firstborn in 3 months. And from January, or in January, I should say. You would like to know what paperwork he needs to do so that he can take his 12 weeks of paternity leave. Absolutely entitled to that. You can get him over to HR and get him oriented. But you also got to be thinking about the department and maintaining that department's functionality at meeting the needs. So using the sheets that were provided, what concerns do you have, understanding those profiles of Fred and the other available individuals in the department? What concerns do you have and how will you address these concerns? Like I said, we'll go back to reviewing each scenario. Scenario 2 is it's late on Friday. Thank God he waited till the end of the day. Bruce comes into your office and he says that after his many years of service, he's been there forever. He believes it's time for him to hang up the cape and retire in February. So the same concept is what concerns do you have, how you address it. So take a look at the sheets. I'll give you 5 minutes to review it. I put one on each, well, I put one set on each table and I put one different one on each chair. Please work as a group, come up with some ideas, and we'll review it. So the question is month 1 January? This is not fiscal year. This is calendar year on the paper. Nope. So you'll see it on the sheets. I'll flip back to scenario 1 so you can see it. If you need me to repeat the scenario, just let me know. More than happy to. 2 minutes. Starts in January. Fred is taking off in January. Wilma. All right, wrap up your conversations. Retiring in February for the second one. All right, wrap it up. Okay, it's January. Congratulations, Fred and Wilma, on your newborn baby girl. She's wonderful. We now have to deal with Fred being out for the next 3 months. So who has some ideas on what concerns we have for January, February, March? Go ahead.
I think you're gonna struggle with trying to replicate his work because he reaches pretty much his maximum potential based on the last year.
Okay.
And so to try to replicate those hours, that becomes an issue. And then also when he comes back in the fourth month, again, you're looking at a pretty close to peak production from him, which obviously when he comes back, it's not right back. It's gonna take time to kind of get done and get back to the swing of things.
Okay, just for those that didn't hear and for the recording, one concern would be that his workload, he's been relatively effective at meeting his peak capacity. Similarly, as such as when he returns, it's going to be the same thing. So he's going to have a lot of backup work to catch up on. So what are some other concerns that you may have? Go ahead, Frank.
Marty and Betty could pick up some of the slack, both have low work hours in January, February, March.
Very true. Very true. In the back. True, very true. So those comments were that Betty and Barney do have some availability, but yet Betty typically looks to be taking some time off from last year's perspective. around that same time span. So there is concern that Barney may have to absorb all of that workload. Evelyn, second in the back on the left corner here.
Yeah.
Stage left.
Barney and Betty, their workload, obviously, in that first 3 months, a bit lower. Their focuses are different than Fred's, so there could be that education gap of, I think Fred was inflators and ventilators.
Correct.
Where Barney and Betty are not covering that currently, or weren't last year. That education gap would be there.
Correct. Very true. So the Fred's workload is primarily vents, defibs. It doesn't look like Barney, Betty really specialize in that. So there's some concerns there. Evelyn? Similar? Okay.
PM based, so you have to ensure you're planning ahead because it's also defense or emergency.
Fair.
So definitely have to have a plan or some backup
Yep.
with experience or training.
Okay.
They
Go ahead.
also know Fred specializes in ventilators, also looking at PMs over the 12 months. January to March, again, being winter time, I would expect the utilization of ventilators to be much higher. So likely the PMs are not, hopefully they're later, in the summer when the utilization is down, but just also something to consider.
They are not. They are in quarter one, conveniently timed for flu season. All right, so how would you address it? What are some ideas? What is your plan of action with Fred stepping away for his well-deserved time with his family?
Looks like Barney has the time available, a little bit of defib and ventilators. I would be putting the preventive maintenance. It looks like that's probably the biggest majority for Fred. Putting the preventative maintenance on Barney, and then the corrective you're gonna have to probably spread across the rest of the team.
Very true. Well, that's Barney does have the knowledge background from some of his PMs historically. Does appear to have the availability. Can probably pick up the slack. That's a good point. That's
The
it.
Dynamic SAM Duo, we looked at what was happening in December, and we know that it's typically a tough time around the holidays, but it's an option to short cycle some PMs.
Interesting idea. Short cycling the PMs and moving them up to compensate. It's a good plan. Evelyn?
Go out and do a third party or machine manufacturer if you just don't have the RPF to plan it.
You could plan ahead. You can call in extra assistance, eat that cost, get the approval for the budget if you need to. This is planned. It's 3 months from now. So, go ahead.
Not from necessarily a data perspective, right, but I think it's a good plan to go departments that Brett typically works on. Make sure that hopefully they're putting in work orders, not by calling Brett directly. If they are, great opportunity to emphasize that call the shop or use. Put it in work order and say, hey, Brett's not going to be in the next 3 months, but in the meantime, we have this backup.
That's fair. Customer service, letting them know the scenario that Fred is going to be off. Perhaps Fred does not want to share that he's having a child. That is fine. Do not share that. But letting them know that you have a plan and being prepared, keeping them in the know. That's huge. Also telling them not to call Fred directly because that is not going to go well for their ears if they do that at that time. All right, moving on to scenario 2. So Bruce is hanging up his cape. We have Clark and Barbara available, possibly, maybe. So what are some concerns that people have? Give Clark a raise. Clark may seem like a Superman from this list, perhaps. Any concerns that were identified other than that? Barbara spends a lot of time on the computer. Okay, interesting. Anything else? Evelyn?
Bruce seems to be the most evenly spread, so he may be a higher position.
Okay. Bruce may be a higher position, seems evenly spread. How do you backfill that? It's fair. It's fair. Looking at his equipment, that does seem like the case. He's primarily OR, it looks like. So that's certainly high risk area. It's a major area of concerns. What would you do to address it? Okay. Any other concerns? One that I picked up on was Clark seems to work on the first asset as well as the second asset, third and fourth that the institution ever had. And we are now up to 975,245 asset number. So that's probably very old, or you just bought a lot of stuff. One or the other. But he's also spending a lot of his time repairing things. Probably that equipment, because it's older than time itself. No. Clark's just very good at going places and being the hero that saves the day, I guess. Superman, if you will, yes. All right. How would you address Bruce retiring?
I think analyze what is currently happening. Clark has a lot of corrective
Mm-hmm.
determine why it's so high. Is there a way to fix that so it lowers the number of hours?
It's fair. Address Clark's corrective maintenance time, understand the reason why, maybe address it in some way, perhaps replace some of that problematic equipment so that he has more available time and he's not constantly repairing stuff. Okay. Becca? Mhm.
More or less admin. What
That's fair. Barbara does appear to have a lot of admin time, but she does have overlap, almost as if she was training underneath this Caped Crusader in the same area, in the same locations at Gotham Surgery Center. Oof. So perhaps that workload can be shifted, moving that admin time to someone that is more available, or perhaps a new employee that's easily able to be hired, onboarded, moving her into taking on that equipment.